They say it is better to be lucky than to be good. But over the past few weeks, the Romney campaign has been very lucky, very, very lucky, because their candidate, back when he was governor of Massachusetts, did something very good. He passed a near universal health care reform bill. That was in '06, and now new numbers out of the Bay State show healthcare costs are growing more slowly there than in the rest of the nation. Between '02 and '06, so the 4 years before Romneycare, employer-sponsored healthcare premiums for Massachusetts families rose 6% faster than the national average, so it was going quicker. From '06 to 2010, the period after Romneycare, premiums for Massachusetts families increased 3% more slowly than in the rest of the country. It's a 9 percentage point swing for them in the right direction. Bully for Romney. What good news. Then this week, a new study came out that looks at self-reported health in Massachusetts. So did Romneycare improve the health of his constituents? Oh, yes. The authors found improvements in, quote, physical health, mental health, functional limitations, joint disorders, body mass index, and moderate physical activity. So in pretty much everything. And what's more, they found those improvements were largest for the groups that the law had done the most to help. For Romney, this is great news. I mean, fantastic news. To have such striking evidence of the success of your central legislative achievement come out right in the middle of a heated presidential primary, I mean, man, that is luck. That is timing you can't buy. To flip Alanis, that's like sunshine and rainbows on your wedding day. And so I went to Mitt Romney's website to see how they were celebrating these fantastic numbers. And I clicked over to press releases and nothing. I mean, I don't mean there were no press releases. There were plenty of press releases. Here, for instance, is Mitt Romney today announces Agriculture Advisory Committee. And here's 5 questions for President Obama on Medicare. And here is Mitt Romney, proud to have the support of so many in Kansas, which seems like slightly passive-aggressive, doesn't it? It's a bit like, and what about the rest of you in Kansas? Then I went to his healthcare page. Maybe it was all there. It seemed an obvious enough place for him to put his healthcare triumph. His healthcare page literally never mentions the fact that Mitt Romney, as governor of Massachusetts, passed and implemented the nearest thing to universal healthcare that exists in any state in the whole country. Literally never mentions it, like they forgot, or maybe like they're trying to hide it. Which is crazy, because the healthcare plan he passed is working. It is providing healthcare to more than 95% of the state's residents. It is popular. It is improving people's health. It might even be helping to control costs. But that's not even the really weird thing. The really weird thing is that Romney's page does spend a bunch of time discussing a healthcare plan just like Romneycare. But this one is called, or he calls it, Obamacare. And Mitt Romney hates Obamacare. Now, here's the thing about the Obamacare-Romneycare linkage. During the healthcare debate, Mitt Romney wrote an op-ed for USA Today, this was back in 2009, which he tried to persuade President Obama to do health reform the way he did it in Massachusetts. He wrote, quote, no other state has made as much progress in covering their uninsured as Massachusetts, which is absolutely true. And then he got specific about what he wanted to do. Quote, first we established incentives for those who are uninsured to buy insurance using tax penalties, as we did, or tax credits, as others have proposed. That encourages free riders to take responsibility for themselves rather than pass their medical costs on to others. You catch that? You see what he was saying there? Using tax penalties to push the uninsured to buy insurance is using an individual mandate. Giving them tax credits to help them afford it, that's also in the bill. Obama, who had opposed an individual mandate in '09, he came around to Romney's position. He agreed with him. He took his advice. At the end of that same op-ed, Romney wrote, the federal government can do something we cannot. Take steps to stop or slow medical inflation. Providers are paid more when they do more. They are paid for quantity, not quality. We will tame runaway costs only when we change incentives. And Obama took his advice again. The bill is trying. It spends billions of dollars on comparative effectiveness review to find out what treatments work and which don't. That's how you find out what quality is. It changes how Medicare pays doctors so they get paid then for meeting those quality targets rather than just for doing more. It's exactly what Romney wanted. He took Romney's advice. And what does Romney say? Does he say he inspired national reforms? Does he say that even a Democratic president had to take his approach? Well, on his website he writes, again, quote, when was the last time a massive government program lowered cost, improved efficiency, or raised the consistency of a service? Dude, I don't know when the last time was, but your massive government program lowered costs, improved efficiency, and raised the consistency of service. And Obama followed your advice when he built his program. Advice that said, and I quote, the federal government can do something we could not. Joining me now is Jonathan Gruber, an MIT health economist who helped Mitt Romney design his program and helped the Obama administration design theirs. Jonathan is also, to my knowledge, the author of the only graphic novel about a health care bill that has ever been written. Healthcare reform, what it is, why it's necessary, and how it works. John, it's good to see you.
Good to see you, Ezra.
You advised the authors of both of these bills. You know the laws inside and out. Is there some huge difference between them that accounts for the fact that Romney signed one and is running against the other?
There's no substantive difference that accounts for that, Ezra. Basically, the core of the National Affordable Care Act, or Obamacare, is the same as what we did in Massachusetts. It was based on Massachusetts. It was inspired by Massachusetts. Quite frankly, it wouldn't have happened if we hadn't succeeded in Massachusetts.
And you follow the literature on healthcare reform and healthcare policy closely. In fact, actually, in a lot of cases, you are the literature in that. And you live in Massachusetts. So though I know you've got a dog in this fight, tell me, in your sort of considered opinion, is Romneycare working? Do you think that's a fair read, that it's been at least modestly successful program?
Really, Ezra, it's a very clear read. The goal of Romneycare was twofold. One was to cover uninsured citizens, and we've covered more than 2/3 of citizens who are uninsured. Our uninsurance rate is now down to about 2%, which is sort of European levels. The second goal was to fix a broken and dysfunctional non-group or individual insurance market. And in that market, since we passed this law, we have lowered premiums by 50% relative to national trend. We've done all of this with broad public support. So yes, it set goals and it achieved them.
And towards the end of Romney's op-ed, he said that the federal government can do what states could not, that there is actually a role for them, and realign incentives in health care to focus on quality. Did the Affordable Care Act actually do some of this? Did they take that advice?
So if you could think of the Affordable Care Act as starting with the core, which is Romneycare, and then building on it. Building on it in two ways. One way is actually raising the money to pay for it. One thing Romney doesn't talk about is the fact that his wonderful state program was actually paid for by the federal government. The federal government didn't have that luxury. We had to pay for it. So that's one way the Affordable Care Act's more ambitious. The second way is what you mentioned, Ezra. The second way the Affordable Care Act's more ambitious is it tackles cost control, which we didn't really do in Massachusetts. It wasn't a goal of our law. It looks like we're lowering premiums. That's great, but that wasn't really the goal. On the federal bill, it's more ambitious. It's trying to also, through a number of different avenues, tackle the critical issue of healthcare cost control.
Jonathan Gruber, MIT health economist, graphic novel creator extraordinaire. Thank you so much for being here tonight.
Thanks for having me, Ezra.